Hi class, here's your first online lecture for week 1 of class. We're going to be covering breathing muscles and also the muscles that stabilize your torso. We call them deep stabilizing muscles, or the deep stabilizers. So we'll just go through this slide. This is for week 1, which is your introduction unit. Alright, this first muscle is the diaphragm. I like to imagine that it's a parachute underneath your lungs. What this muscle does is as you breathe in, it pushes downward so that the lungs have room to expand, and so the ribs have room to expand to let the air in. As you exhale, the diaphragm releases its contraction to let the air pass out of the lungs as the lungs shrink and as the rib cage shrinks. The quadratus lumborum is a deep stabilizing muscle. This muscle, as you can see, it's connected to the ribs and the spine and the pelvis, and it also affects our posture in many ways. It helps with lateral flexion of the spine and rotation of the spine, so you will be seeing this muscle again in the next upcoming quizzes. Transversus abdominis, I like to imagine it's like a sheet of saran wrap that is wrapped around your torso. This muscle is an amazing stabilizer if you can find how to activate it, which we'll talk about in class during our exercises. But the reason why it's such a great stabilizer is because it attaches to everything, pretty much to every bony landmark in your torso. First, it connects to your spine. Our spine always needs a lot of stabilization. It connects to the top of your pelvis, this area right here, which is called your iliac crest. It connects to your rib cages. It connects up here at the top of the rib cage, which is called your xiphoid process, and along this area, which is called your linea alba, and connects all the way down to your pubis symphysis. The pelvic floor. This muscle controls your urination. It helps you hold it when you really have to go. This muscle is a very important stabilizer because it's the base. It's the bottom of all the muscles in your torso. And when we can activate it, it's like a chain reaction. And once that is activated and contracting and holding everything together, then the rest of the torso is activating as well. And we'll do exercises to help you find that in class as well. Alright, your interior and exterior intercostal muscles. They are in between each rib cage, on the inside and on the outside of the rib cage. That's why you got interior and exterior intercostals. You can remember intercostals because they're in between each rib. It's like each rib has its own little elastic band attached to it. And what these muscles do is they help the ribs expand. So the lungs expand to let the air in, and they also help the ribs shrink and come close together as the lungs shrink as you exhale. So it kind of works the same way the diaphragm does, but they're all little. And we'll zoom in a little closer just so you can see that picture a little bit better. And there's your first lecture.